This question was presented to the students at the beginning of the class after having completed the related home exercise. Initially, when a normal person with the head tilted 30 degrees forward and the eyes closed, or in a dark room, rotates to the left, the A. Left vestibular nerve increases discharge frequency. B. Left cranial nerve 6 nucleus is stimulated. C. Right parapontine reticular formation is inhibited. D. Left cranial nerve 3 nucleus is inhibited. Okay, choose one. Most of you are choosing B. So let's look at B. B is incorrect. So try again. Now you have a 30% chance of getting the question right. I will give you a few seconds to read the question again. The possible answers are A, C, or D. So what is your answer? The majority is going for A. So let's go for A. A is the correct answer. Why? The why is rather complex, but very logical if we go step by step. This cartoon represents a normal patient looking straight ahead. You can tell by the nose with the head bent forward 30 degrees and the eyes closed. Here I have now introduced the 3 semicircular canals in each ear. Here I have only represented the horizontal or lateral semicircular canals in each ear, which in this head position are parallel to the ground. I am now indicating to the ampulla, the name for the enlargement of the semicircular canal. The ampulla houses the crista. The 2 components of the crista are the cupula, which bathes the cilia, and the ampullary crest. The ampullary crest is the site of residence of the hair cells' bodies. In this frame, I have added 2 diagrams of hair cells to show you the position of the 2 types of cilia found in the ampulla. Here, I am indicating to 3 shorter lines. They represent the regular hair or cilia, specifically called stereocilia, present in these structures. And now to the largest and thickest cilia, called the kinocilium, represented here in red. The kinocilium in the left lateral semicircular canal is closest to the utricle. This is so in both lateral semicircular canals, as shown here. Now I'd like to call your attention to the hair cells on both sides. These cells are represented by the darkest element indicated here. I am now representing the introduction of electrodes in the hair cells. The reference to these electrodes are not shown, but imagine them being in the extracellular space. The hair electrodes show neither significant hyperpolarization or depolarization. Yet, as it is peculiar for these hair cells, they undergo spontaneous depolarization and repolarization at a constant rate when not being stimulated. I am now representing the vestibular nerve and the vestibular ganglion. I have now introduce a rectangle delineated by interrupted lines representing the brainstem and a pair of pill-shaped structures corresponding to the vestibular nuclei. In this new frame, I have represented electrodes recording intracellularly from vestibular ganglion neurons. The reference electrodes are again not shown, but imagine them to be in the extracellular space. Since the head is forward and not being moved, the neuron in the vestibular ganglion being recorded show steady discharging, both sides doing so at similar rates, reflecting the spontaneous discharging of the hair cells. I will now introduce a cartoon showing the CNS vestibular pathway and extraocular muscle relevance to answer this question. And here it is. The elements inside the circles have already been represented in the original drawing. The pill-like structures in the initial figure are the vestibular nucleus corresponding to this structure. The dark blue lines represent the connection of the vestibular nucleus with the contralateral parapointine reticular formation, the organizer of lateral eye movements. The brown line connects the parapointine reticular formation and the ipsilateral 6th cranial nerve nucleus. This nucleus has two populations of neurons, one going to the abducens nerve to innervate the lateral rectus, and a second group of neurons that send their axons across the midline to the other side, joining the medial longitudinal fascicle, ascend and innervate the median rectus subnucleus of the common oculomotor nerve. This subnucleus innervates the medial rectus muscle. Now I'd like to call your attention back to the black and white figure. As you can see in this figure, the intracellular recording of the vestibular ganglion nerve cells are discharging simultaneously at a steady rate. Thus, the net effect is no eye movements. But when the head turns towards the left, the fluid in the left semicircular canal, because of its inertia, lags behind the movement of the head, thus creating a flow towards the right, as indicated by the thin arrow. This flow displaces the hair cells in the left horizontal canal ampulla towards the kinocilia. It may be that since the kinocilia is thicker, it is less bendable by the forces produced by the displacement of the semicircular canal fluid, or maybe some other mechanism is involved that we do not really understand clearly. Whatever the reason may be, the displacement of the cilia induces sustained depolarization of the hair cells, triggering repetitive action potentials and an increased release of excitatory hair cells neurotransmitter. The increase in neurotransmitter at the hair cells triggers action potential at the distal end of the vestibular nerve that travels to the vestibular ganglion. Upon arrival to the vestibular ganglion neurons increase their discharge rate, as you can see here. The effect of left head turning on the opposite horizontal semicircular canal, the right one, is reversed. The inertia of the fluid in the right horizontal semicircular canal displaces the sterocilia away from the kinocilium and the utricle. The hair cells hyperpolarize, less excitatory neurotransmitter is released, and their discharge rate decreases. Now let's turn our attention to the colored diagram by the side. We are doing so in order to trace the consequence of the changes in discharge rate of the neurons housed at the vestibular ganglion. During left head turning, as you know, the left vestibular nerve increases its discharge rate and the right vestibular nerve decreases its discharge rate. I will make use of positive and negative signs to indicate the consequence of these peripheral vestibular discharging patterns. The result of the increased rate of left vestibular ganglionic cell discharge is to excite the left vestibular nucleus, as indicated by the positive sign in the left vestibular nucleus. The result of the decreased rate of right vestibular ganglionic cell discharge is to inhibit the right vestibular nucleus, as indicated by the negative sign in the right vestibular nucleus. The result of the increased discharging of the left vestibular nucleus is to excite the right parapointed reticular formation, whereas the result of the inhibition of the right vestibular nucleus is to inhibit the left parapointed reticular formation, which inhibit the two populations of cells in the left cranial nerve 6 nucleus. Consequently, the left lateral rectus muscle is inhibited, the right medial rectus subnucleus is inhibited, and so is the right medial rectus. On the other hand, the excitation of the right PPRF will excite the right cranial nerve 6 nucleus, will produce contraction of the right lateral rectus, and simultaneously excite the left medial rectus subnucleus and contraction of the left medial rectus muscle. This will bring about slow movement of the eyes to the right. As shown in these frames. So the answer to this question, as previously stated, is A. Just one more thing before we finish. I have included 3 additional frames in this talk. They require a little bit of reading. They explain 4 ocular reflexes whose interpretation is important for clinical practice. The rotatory reflex is only tested at special labs. The oculocephalic, optokinetic, and caloric reflexes are elicited at bedside. The explanation in these frames only addresses normal responses. Please take the time to read them. In this frame, I am discussing the rotatory eye reflex. In this new one, the oculocephalic reflex and the optokinetic reflex. And in this one, the caloric reflexes. Thank you very much for your participation.